Hello everyone, my name is Hira Elias and I'm a fourth year student pharmacist at the University of Connecticut School of Pharmacy and Pharmaceutical Sciences. Today I'll be talking about the potential for oral step-down therapy in our pediatric patients with endocarditis. This is an overview of the blog post Oral Antibiotic Transition for Pediatric Endocarditis. Is it ready for prime time? And goes over the adult trial, partial oral versus intravenous antibiotic treatment for endocarditis, also known as the POET trial, and also the newly published case series by Seattle Children's Hospital. You can find this blog post on the University of Connecticut School of Pharmacy and Pharmaceutical Sciences webpage under the April 2026 blog post. Hello everyone, my name is Hira Elias and I'm a fourth year student pharmacist at the University of Connecticut School of Pharmacy and Pharmaceutical Sciences. Today I'll be talking about the potential for oral step-down therapy in our pediatric patients with endocarditis. This is an overview of our blog post, Oral Antibiotic Transition for Pediatric Endocarditis. Is it ready for prime time? And goes over the adult landmark trial, partial oral versus intravenous antibiotic treatment for endocarditis, also known as the POET trial, as well as the newly published case series by Seattle Children's Hospital. You can find this blog post on the UConn School of Pharmacy and Pharmaceutical Sciences webpage under the April 2026 blog post. Historically, endocarditis has been treatable through IV antibiotics. Treatment with antibiotics ranged between 4 to 6 weeks for patients depending on the severity and the type of bacteria they were infected with. Stable patients could be discharged from hospital and placed on outpatient parenteral antibiotic therapy, also known as OPAT, reducing their hospital stay and overall costs. The downsides to OPAT, however, is the need for a central line, as well as having home care nurses come or having added caregiver burden with administration. The POET trial was published in January 2019 and helped pave the pathway for an oral antibiotic step-down therapy in clinically stable adult patients diagnosed with endocarditis. In addition to the POET trial, additional studies have been published that showcase the real-world effectiveness of the oral step-down therapy. With all this information on the adult population, the pediatric population still lacks robust data. A small number of patients who received oral therapy as part of Seattle Children's Hospital's own in-house protocol was conducted to see if oral step-down therapy in our younger population may also be viable. The report was published recently and it showcased that it was successful. Unfortunately, further research is needed within this area. The POET trial was a non-inferiority trial that randomized 400 adults with left-sided endocarditis in a 1-to-1 randomization to either continue receiving IV treatment or to be transitioned for oral therapy after receiving IV treatment for 10 to 14 days. The purpose of the study was to evaluate the safety and efficacy of transitioning these patients. The bacteria being treated in this trial included gram-positive Streptococcus, Enterococcus faecalis, Staphylococcus aureus, and coagulase-negative Staphylococci. The results of this trial did not include any gram-negative bacteria. At the end of the study, the results showed that shifting to oral therapy was non-inferior to continuing IV treatment. The primary outcome has occurred in 24 patients, or 12.1% of patients, in the IV treated group, and 18 patients, or 9% of the patients in the orally treated group. Focusing on our younger population, Seattle Children's Hospital conducted a retrospective review that included 8 patients following protocol-driven oral step-down therapy. The overall evidence for our younger patients is lacking, and the protocol was created to assess if this would be efficacious in our younger population as well. Of the 8 patients that transitioned to oral step-down therapy, it's important to note that their age ranged between 10 months and 20 years. It was also important to note that there was an 88% success rate in this oral step-down therapy where 1 patient failed due to a progression of their cancer. In addition to the expected gram-positive endocarditis patients, there were 2 different cases where a patient was infected with at least 1 gram-negative bacteria. 1 patient had Serratia marcescens and Enterococcus faecalis, and another had Haemophilus parainfluenza. This is important as the adult study only included individuals with gram-positive organisms in the IV to PO transition. The oral regimen that was used is as followed: amoxicillin plus rifampin plus Bactrim, amoxicillin monotherapy, linezolid plus levofloxacin, levofloxacin monotherapy, and Bactrim plus ciprofloxacin. What can we as pharmacists take away, and why does this matter? The 2023 European Society of Cardiology guidelines incorporated IV to PO therapy as recommended strategy for selective infective endocarditis patients from the data found within our POET trial. The POET trial also helped influence Seattle Children's Hospital to conduct their own case series to further showcase its use within the younger population. Additionally, we can compare the antibiotic regimen used in the POET trial and the Seattle Children's Hospital protocol. With the POET trial, because there were over 200 patients within the oral transition group, their antibiotic regimen was more robust. Here are some of the most commonly used antibiotic regimens used in the POET trial. It's also important to note that this trial was conducted outside of the U.S., so medication like fusidic acid, while is common outside of the U.S., may not be seen in our local practice sites. Seattle Children's Hospital used a mix of combination and monotherapy for their patients. Here are our references used in this blog post. Thank you for watching. The full blog post and article can be found by following the link on the screen. If you found this video interesting, please be sure to like, follow, and subscribe to our channel, and check out our blog for more pediatric infectious disease and immunization updates. Have a great rest of your day. This concludes our Pediatric Infectious Disease and Immunization Update series. A disclaimer, this video is only for educational purposes only and is directed towards healthcare providers and educators. A full disclaimer can be read on our screen below.